um, to approval of the agenda. Does anybody have any concerns or questions, changes to the agenda?
Madam Chairman,
Yes, sir.
I'd like to make a change to the agenda to accommodate our consultant will be calling in from Texas. So item G number 2, the trends in CapEx index allocation, to request if we could move that to right after the consent agenda.
Absolutely.
So before E and after consent.
Any
Make a
problems?
motion to do it with this change.
Okay,
Now, is there two agendas that were, oh no, we're the one today, okay,
the one today.
okay.
I'll second.
Thank you. And I didn't ask ahead for a flag salute, but John, can you do flag salute for me?
Yeah.
And Mark?
Certainly.
Who are next? And where's the,
Sure, right hand over your heart and repeat after me.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Heavenly Father, when we come before you this afternoon for the Board of Directors meeting, we just ask that you be with those of us who couldn't be here today. Just touch their lives in a way that is encouraging. Father, we ask that you, as we make decisions for the district, we ask that you help us to make right decisions and profitable and just lead us in a good direction. In Jesus' name.
thank you. So number 3 is the mission statement. We will provide high quality, efficient patient care services that respond to the community and providers' needs. We will provide leadership in health promotion and education for our patients, residents, medical staff, employees, and community throughout the district.
Madam Chair, this is a point of order. I think we still have to do the vote on the approval. We did a motion in a second. but-
Oh, yeah, you're right. You're right.
Yeah. so
Don't be sorry. I was gonna do that after the mission statement.
We can do it at the end of the meeting.
No, that's since we are all here, is there a vote of yes to the changes or nay?
Yes.
Yes,
Yeah.
yes, yes.
Actually, she was okay because this whole section is approval. It could come.
You know what? As long as I can keep
We got a double.
employees happy for half a minute, I'm good to go. Can't ask for much than that. Yes. Okay, thank you. So, B is the, public comment. And there is, I see Ben is on. David's on. So if there's anybody who wants to make a comment, and is Ben still hired? He's not public?
He's an employee.
Okay, then we
And
don't
he is
know
public.
him. He's both.
As
So-
am I.
If there's anybody that wants to, this is the time of the meeting reserved for persons to address the board on any matter not on the agenda, but under the jurisdiction of the board. They may ask a question for clarification, make a referral to staff for factual information, or request staff to report back to the board at a later meeting. Also, the board may take action to direct the staff to place a matter of business on a future agenda. The board cannot take action on these items, on the items not listed on the agenda for action. Speakers are limited to 3 minutes. Please state your name before making a comment. Does, Ben, do you have a comment you wish to make?
I do not,
All
but
right,
thank
well,
you.
Thanks for joining. Then number D, or letter D, is for consent of the agenda. The following items are considered routine and non-controversial by the hospital staff. Consent items are listed as actions items that may be approved by one motion if no member of the board or audience wishes to comment or ask questions. If the comment or discussion is desired, the item will be removed from the consent agenda. So at that time, we discussed that. We did make changes and it was approved. Decide on,
One,
okay.
we have one contract here under section 5 that is no longer valid. That was the Merlin Shown Residential
No,
Trust.
that's right, yeah.
That was
Okay.
for the HRP, Human Resources and Public Relations, so that should be just taken.
Okay,
And did Sally get notified of that too, so she could take it up?
I'll let her know.
We talked about that at finance, it's supposed to be taken off.
okay, so, since we did make a second change, if I can have, it's ever,
Motion to approve is revised.
thank you.
I'll second it. Vice.
All in favor, say aye, please.
Aye.
Any rejections? No? Thank you very much. So, next is reports.
If we could do that Tri-Send item.
Oh, I thought you said after his, sorry. So we're gonna do the Tricent Cap X, index. So Tim, sorry, I called upon you. Apparently I'm not ready for you. So, and Ross, I don't know if you have anything to speak on this before, but if not, it's gonna be for David. Hello, David. Thanks for joining us.
Hello, good afternoon.
Hi, David. I'll just give a couple of introductory remarks. This is an investment that the board made a couple of years back. We have to make a decision annually on how we want to invest the money. And there are 5 options available to us, which David is going to explain. So
Okay,
that's the reason this is on the agenda, is to decide where we want to invest our money in the upcoming year.
okay.
All right, well, good afternoon, everybody. Yeah, that's exactly right. Just for reference, under section 1.4 of the agreement that governs this arrangement with Tim and the district has the ability to choose the index allocations for one of the life insurance policies associated with that plan. It's called the repayment policy, and that policy was issued by Nationwide Life Insurance Company. And it is currently fully allocated in what's known as the 1-year multi-index strategy. And to just give you an idea what that entails, that is an index that is weight averaged based on the change over a 1-year period of the S&P 500, Dow Jones Industrial Average, and the NASDAQ 100. The way this index works is the highest or best performing index receives the highest weight of 50%. Second best performing receives a 30% weight, and the third best performing receives a 20% weight. Right now, adding all of that up, all of those indexes are very much in positive territory over this last year. And again, that year started 12/15 of 2023, and it's going to mature in December 15th of 2024. But as of today, if you weight average all of those indices and add all that up, it's just under 17% in total. But the cap, you can remember this transaction or this policy has a floor, meaning a minimum. It'll never make less than 0, but then there's a cap imposed as well. That cap is 10.25%. So if everything would have closed today, this policy would credit at its maximum rate, which is fantastic news. It's what we all hope for. So with that as a little bit of background, again, we've got several more months to go before this fully matures, but with that as a backdrop, there's sometime before December 15th of this year, the district needs to decide if they want to stay with this current allocation. There have been some changes to it, so I want to talk through that, or switch to another allocation. And again, that was a correct statement. There are 5 that are potential alternatives here, and we can walk through each one of those. I believe it was in the board materials, if I saw that correctly. If we could talk through what those alternatives are and why you all may want to consider a change. But I'll let you all give you just a second to find it so we can look at some numbers together.
That's
Again,
page 64 in the packet.
There you got it.
Okay, so you'll see those those 5 alternatives. The top one on the list is where you all are right now. I will say there's one pretty significant difference between what's on the sheet that you're looking at and the current segment that you're in. The current segment that you're in has a 10.25% cap. Going into next year, that cap on that strategy will be 7%. So that means the maximum crediting you would be able to get under that strategy would be 7. Now, there's an alternative to that, which I'll talk about here in a second. But again, still a great allocation, but I think your opportunity for upside is limited. You can also look at the 1-year S&P 500. So instead of being blended among 3 indices, you're actually looking at a single index S&P 500. Minimum crediting of 0, maximum crediting of 6.5. Again, a little bit more limited yet. You're not as diversified, and you're a little more limited in what you can get in terms of the upside. Third alternative is what's known as the uncapped S&P 500, which sounds fantastic because there's unlimited upside, but I want to call your attention to the next to last column on the right, what's called the spread rate, if you see that. That spread rate essentially means that you will get on an uncapped basis, or the policy will credit on an uncapped basis, everything above 10%, but you're going to give up everything between 0 and 10. That's a tough one to swallow. There have been times where that spread has been in the 3% range, and that'd be something worth talking about. I can't imagine giving up 10 percentage points of gain to get the uncapped, but nonetheless, it's there to be considered.
But can I ask a question?
You sure can.
When do we need to make the decision? Because there's an election this year, and it could make a difference.
Very much so. The good news is you have until mid-December, probably let's call it the first week in December, to make that call. You can see the impact of the election and then make a judgment call.
We could communicate with you for December board meeting or after it.
Absolutely.
Just a thought. I don't know. Thank you.
You're welcome. But you're right. That could make a significant difference. And then the last two I'll call your attention to is the high cap multi-index and high cap S&P 500. They're very similar to the first two on the list, except they have higher cap rates. And the reason they have higher cap rates, if you look at the column far to the right, something called a charge rate. And that's essentially what you're doing would be agreeing to increasing the policy charges by 1 percentage point in order to, quote, buy up that cap from, again, I'll use the first example, from 7% to 10.25. These last two, I'm sorry.
You said increase it by 1%. What is it at right now, George?
You're at 0% right now. So when a carrier's options budgets, and this is a little technical, gets squeezed, the cap rate is the thing that comes down that allows the carrier to equalize this. If you agree to some additional policy charges, that gives them more of an options budget and then allows them to go buy higher caps. So in this case, the way I look at it, and again, this is probably a little bit elementary, but think of this not as a 0 and 10.5%, 10.25% cap with a 1% increase in expenses. Just think of it as a 9.25% cap and a -1 floor. That kind of helps draw it parallel with all these other alternatives. And it would be the same for the 1-year S&P 500 high cap as well, 7.75% -1 floor. I think certainly one of those last two is worthy of consideration, just because you've seen the cap rate on the strategy that you're in now come down to a point where you're fairly limited on what you can get in terms of upsize.
You're saying -1 floor. That's if we lose money. Under all the rest of them, we don't lose anything. But on that one, we lose 1%. Is that the way I'm hearing it?
That's essentially the way you're hearing it, just because you're increasing your expenses by 1%. So it would have the effect of a -1% floor. And the other thing I'll say as you all are thinking about it is you don't have to put all eggs in one basket. So if you wanted to keep a portion in the strategy where you are now and then put a portion in the high cap, you can also do that as well. So don't think of it that you have only one, you have to agree and put it all in one place. You can actually spread this out over multiple indices.
Is your Are you recommending what we did was it last quarter or did we do it?
Sure.
Okay.
Anyway.
The way it has been done looked like it's done pretty good.
It's done very well. Again, the only thing that gives me pause on staying where you're at is the fact that the cap rate has come down. So right now your cap rate is 10.25. It's coming down to 7. So that gives me a little bit of pause because I think your upside is limited. Again, you're doing fine, and that would be a fine place to stay. I could see making it, again, I'm just giving you my opinion. I could see moving some or all of it to that 1-year high cap multi-index. I think it may be worth it to increase the policy expenses to have that additional upside.
You said
Worth a thought.
17% this year, so we basically lost 7% of the game because we're capped out at 10.
Capped out at 10.25, and if you did that again as of today, 16.91. So you lost. Well, you quote lost. Let's say you were not able to grab all of the gain in the market, but just remember you also didn't take the risk of loss either. So it's
Risk of
pretty
reward.
fair trade.
Yeah, I agree.
Gene, you also had a good point saying regarding November.
Yeah, I think we should wait until, sometime, one of the building planning meeting, we can discuss it.
Yeah.
In November.
Said, any chance of these changing between now and after the election, or these locked in at these rates?
Your cap is locked. The cap rate is locked in here, but these underlying indexes obviously can move. But they're all three. So for example, the S&P over this period is up 18.57%. The Dow Jones up 10.16, and the NASDAQ 100 up 18.6. So they're solidly in positive territory. But again, before this segment matures, you're going to have to go through an election, and it depends on how the markets react to that result. So yes, this could change. Love where it's at now, but again, we don't know if the markets are going to panic one way or the other.
So would it be prudent, under your suggestion, to basically refer this back to staff and bring it back to the November meeting?
For either the November meeting will be after the election.
After the election,
Yeah, yes.
we'll be able to see what it's
Yes,
doing.
right.
Yeah, right.
Yeah, have another couple of months under your belt in terms of this, plus know that result. I think that could be a wise thing to do.
All right, so
Do we need a motion?
I don't know. I'll make the motion. We defer this until our November meeting.
Okay, go. Will you be available? Oh, no, we can communicate. We understand it,
Yeah.
right?
Yeah.
But that said, I will make myself available if you all need me.
Thank you, David.
Thank you. We'd like that. I'll second the motion.
All in favor?
Bye.
Okay.
See you in a couple months. Thank you.
All right. Thanks, everybody. Have a great evening.
Bye.
Have a good day, sir.
Bye-bye.
$5, dude.
You should have one of those. Joes.
The Exchange Club has a $5 fine.
Yeah.
I'll stop by
Like
there.
more if you answer it.
I'll stop by there at this meeting. Okay.
That is funny. Okay,
Call me David.
thank you. So that's something we need to keep an eye on, I guess.
Yeah,
I
well,
mean,
make sure that Heidi puts it back on the agenda for November.
For November sport.
Yeah.
And anybody who wants to can look at it between now and then.
Yeah, so we can see what it's doing.
Yes.
Oh, yeah, I see it every morning on the news. I'm like, so.
It's a long term.
Yeah, okay. So back to reports. I'm sorry, Tim.
Hey, not sure if all you were aware, we did have a PSPS event yesterday. They had called us about it. They actually did bring the generators out yesterday morning and left them here in our parking lot and the other two buildings. And literally, early yesterday afternoon, they sent out notices that looks like we are going to turn your power off within the next 4 hours. They sent that message out probably about 8 times over the next, my last one I got was at midnight, 12:04 a.m. And then at 4 a.m., finally got the notice saying weather conditions have changed.
I got the one at 4 too. Man, that's early.
So, anyway, yeah, so they came this morning and they picked up the units and stuff like this. And then Bob and I had a conversation with Edison just before the meeting started. And because of the number of fires that are going on down in LA and San Bernardino County, they said, we really need to reconsider our ability to bring generators out to you guys. So as we understand you have a generator, so there may be some things you need to look at in terms of maybe finding a backup generator to provide for the things that your current generator isn't covering. But they just said they got so spread out and just the costs, because these units were coming from LA, so they had to bring somebody up there. They have to leave somebody here all night long for each of the 3 sites to oversee that nobody does anything to them or takes them or whatever. So, we said we perfectly understand that, and that's not a problem. So Bob and I are going to take a look at some things. We can go back to Quinn or whatever that we're renting our other generator from and see if they've got a smaller one or what they can bring to us. So anyway, that's kind of what's happening there. The FEMA visit we had last Monday, and they came out. They sent 2 people out that were consultants. Ross was there. Appreciated him coming out. And primarily looking for cultural or historical impacts that the construction project might have on the community. One of their big concerns with this is this hospital was built, over 50 years ago. And so at that time, I don't know if many of these houses were here, if anything. So they said, because this land, obviously, the alluvial field coming down, this was on a hill. So they had to get filter from the local area here to level off this lot. So they said, as that dirt was removed, there could be artifact in that dirt that was dumped onto the property here, and so forth. And so anyway, the bottom line was that as they went around, did their searches and things like that, they basically felt comfortable that it was not an issue for us. And so they were going to go back and render their report that everything was good to them, and so forth. So, I think the best thing for us, obviously, is we weren't having a lot of new excavation going on, primarily because we're staying within the confines of the original building. The only areas that we would see would be some of the footings for the canopies that they're putting in along the front and out by the ER. And they just said, they're going to go down 3-4 feet and dig out and put those footings in and stuff like that. So likelihood of finding anything would be pretty remote. And if they did, we'd have to obviously report that. And so anyway, so they said no, they reiterated they're not in the business of trying to prevent people from getting money. They're here to basically help us and so forth. But they said that any of the major projects that the government is funding, they have a responsibility, obviously, to make sure that they've checked all the boxes off, because if someone comes back later and said, hey, you built on an Indian site or, whatever, they'd have to approve that they've done their homework and so forth. And that's really what this was. So against whatever that list that they have that they work off of, we've now cleared that next box. And so don't know how many are left on that list, but obviously we're still in progress here with that, which is great news. CHA kind of finished out the legislative year. I think I sent this out to all of you, was kind of the highlights of the year from CHA's perspective. Had a number of bills that were approved or denied, as we were hoping they might be. But all in all, I think there was all but 2 that were favorably but in our favor. The 2. The seismic, obviously, mandate SB 1432, which is but to provide an additional 5 years of time to do your seismic upgrades. That's been approved. That is going on now to the governor for signature. There was a second seismic bill, which was identified primarily for the small rural hospitals that would allow for a 3-year extension and so forth, with potential for additional years after that. That one also passed. Then, let me see, there was, yes.
On those two, I didn't look up the bills and read them. Is there any negative side to them, like, tied to minimum wage or anything like some of those earlier proposals had?
No, not on these bills. There was one bill, like I said, that they were putting forth to try and develop a program for the critical access hospitals that would have provided us the opportunity for cost-based Medi-Cal services for all of our healthcare services. That bill actually did pass, but it was modified. And so now it doesn't provide that. What it does provide is for a technical advisory group to be created with the Department of Healthcare Services that would allow critical access hospital, and they're going to ask us which ones we want, if we want to be a part of that or not, to meet with them to go over the needs. The big issue is to really try to make sure that there's reimbursement issues are addressed to make sure that critical access hospitals will stay open. That's really what it comes down to. That's.
Jim, is there anything in there, if we can't get the funding, they would extend it indefinitely? I mean,
Yeah, that was one of the components of one of the bills and so forth, that it's would be done, I think, in concert with reviews by OSHPD and so forth, that we would sit down. Again, and like I said, this was an issue that we knew for Kauai Delta, because they're looking at a $700 million project. And they said, I don't care if it's 5 years, 10 years, whatever, there's no way we could fund $700 million. So, and there's a number I know.
cool, that's
Hospitals here in
good.
Kern County
Very good thing.
were the
for
same
us.
way, and they just said, listen, we're just not gonna be able to do it, period. And so, there's a lot of sense going around that there will be a lot of easing of some of those restrictions. And it's interesting because they're not gonna come out and definitely say, yes, you can do this. What we've been told is that each hospital has to approach OSHPD and have those conversations with them yourselves. And again, they're going to discuss the reasonableness, what your cost issues are. And then they will individually make a plan with you as to how to go forward and so forth. And so, but they don't want to come out and say that. So they're telling,
Yeah.
and several hospitals have already done it. So
How would that affect the FEMA grant?
it wouldn't affect the FEMA grant. The issue where it could become an issue, and it really depends upon how long it takes us to get the FEMA grant.
Right,
Because as we all know, the costs are going up, they continue to go up, and so forth. And, the issue that Bob and I have been following very closely is, again, as those costs go up, even if the FEMA grant comes through, we have monies, obviously, we've set aside for this project. And if it looks like that we're not going to be able to find a construction company that's going to be able to get it done with the monies that we have, even with FEMA, then we're at a point now where we've got to decide, okay, we're not going to do this. And so therefore we would just tell FEMA, again, we're not going to take the money, we refuse the money.
Or would FEMA let us go to the 6th stage and still pay us 75%?
Yeah, that'll be
What
a
we agreed to.
conversation we have to have.
Because
Yeah,
we did the stages for a reason.
right.
And so,
Yeah, that was all part of the plan. I mean, obviously, that was all well documented in submission to them as to the timing of that plan. So, yeah, we just have to have the conversation. But, yeah, obviously, that's, as we've all discussed before in other meetings, that's a concern, obviously, as these prices continue to rise. Will we be in a position to finish this project? So.
well, we'll look at that again after the election.
They're gonna have a list of things to look at. after
Everything
the election.
could be totally
Yeah,
different,
so-
who knows?
Some of the other things, there was the psychiatric services and emergency department. This was a bill that was identified to primarily force the health plans to pay for any of their patients who end up in our emergency rooms with behavioral health issues. They have to pay us. And it's not a one-time ER rate. It's every day, whatever those costs are, the health plans are going to be required to pay those. If that person is sitting in there, there's no place else to get them.
they limit psychiatric care drastically.
Yeah.
You know that.
Yeah, well,
So what they've done is they forced it on hospitals to manage their 5150s when there are no beds available. And now we don't, right now, hospitals don't have staff to do a one-to-one for a suicidal ideation. This bill would help us bill for that service or that coverage.
yeah, it's like one of those things, like I said, that, you know, again, there's language in there that empowers hospitals to promptly transfer patients to inpatient psychiatric care without delay. And it's just like, yeah, we do that every day, no matter what, just because we don't have the ability to deal with some of those psychiatric emergencies that come in. And so where the issue is Mark's bringing up is the fact that there's no beds to transfer them to and so forth. So in that event, that's where the payment's got to be there to help make that.
One of the other requirements is that
Pay for us.
if somebody's on a 5150, there is a mandatory contact with a psychiatrist within 72 hours.
Yeah.
I think it's 72 hours, and I don't have a psychiatrist on my phone.
Can we do a telemedicine thing?
You can do a telemedicine thing, yes, and that's what they're proposing.
So,
Would Heather Berry qualify for it?
No, it has to be a psychiatrist.
yeah,
Okay.
LCSW. And do we have plans or should we look at plans to get our staff more education in that area?
We're
And-
looking at
We're talking, I'll get to that in a minute. Yes.
Okay,
That's
sorry.
another agenda item. The state budget was one of the ones that obviously that the hospital association said we lost that one. And this is the one that was primarily going to take at least the $1.5 billion out of monies that were supposed to be provided to the providers for payments, both the hospitals and the physicians. And the governor basically took that money out and to put it in the general fund or wherever he's going to put it. And so the Hospital Association is sponsoring a ballot initiative to force the governor to use that money for what it was intended for, which was payments for the providers. So that is underway. That was a point that the governor was trying to negotiate with. He was pressing CHA to drop that initiative in exchange for his support on one of the seismic bills and so forth. So we're going to wait and see how those negotiations go. There were some others on weapons detection. There was a bill that was making it mandatory for hospitals to provide for screening for weapons coming into the hospital and so forth. There was an exception made at the very end for small and rural hospitals. And obviously because there's just not the money there to do that for all your entrances and so forth. So that one did pass and so forth. So there was one on PAGA, the Private Attorneys General Act. So just a whole workers' compensation, the presumptive eligibility, and that would have required that if someone came forward with an infectious disease or respiratory or cancer or PTSD, that it would automatically assume that it came from a hospital. If it was one of our employees that came down with one of those things. And so that was stopped.
But not board members.
No. You're
Just want to make sure.
the workplace violence bills, nursing education bill that passed. That was one that was going to provide for 10 community college districts that would now be required to develop a baccalaureate RN program in order to put out more RNs into the state and so forth. I don't know where I haven't seen a list of the 10 programs. I don't think it's one of ours.
Nobody called me.
I can't either. So, but anyway, it's good that they're focusing now bills on that education and so forth. And then there was one they were trying to push together a new health information exchange. And so that one was stopped. So CHA considered that the win of the healthcare community. So just a lot of, good effort that went into the legislature this year. I'm sure some of the new bills are already stacking up. Right now, the big issue is these are all sitting on the governor's desk waiting for signature. So we've been writing letters to the governor asking him to sign some of these. Like I said, we've got competing bills now for the seismic. Obviously, one's a 5-year bill. The other's a 3-year plus 3. And so we'll see how it shakes out. But
Tim, I know you sent that out. I apologize. I didn't get a chance to look at it in
Yeah.
detail, but the seismic, one, I think.
Yeah.
I'm assuming some of the hospitals are kind of in different criteria. Like we're in a different criteria than Shelley Salem, Cedar Sinai, which is closer to a fall. So,
the interesting enough, that doesn't make a difference. on
Doesn't make a
seismic,
difference.
No, because like I said, these were, you're still working off the original codes because it's not, nobody's gonna change it.
yeah, I understand that, but I thought at one point they were considering giving more relief to like the rural
They
hospitals.
were,
And then that's
was
not
defeated. That was defeated.
Oh, okay, gotcha.
So that bill, the last 2 years, CHA has tried to do that, but invariably came up against a roadblock with the unions.
It's too bad.
Yeah, and so those were withdrawn. So right now, we still are sitting at that level unless some of these bills get approved, but it's not changing what you have to do. It's just giving you more time to comply.
Which would be 2035 instead of 2030.
Right.
And the second question for clarification was on Medi-Cal. Are they trying to increase the reimbursements for Medi-Cal? Is it still like?
They were trying to do that. They were trying, like I say, go to cost-based reimbursement for all of your Medi-Cal, be it managed care or not. And so the issue was for a number of the facilities.
Some of the smaller ones.
This-
Independent.
Well, it was the not-for-profit, private facilities like Ridgecrest, okay, or Catalina.
Catalina, we were one of the biggest ones.
And so the issue there was going cost-based would benefit them because they are not eligible for IGT. And so especially that rate range one.
They regulate the cost.
What is it?
That could be a real problem.
Hard to
Yeah.
calculate the cost of goods.
Is it very similar to Medicare, like cost plus 1% or?
No, not even.
Not even
You know,
It's low cost.
some of the, it's depending, like Catalina gets about 20 cents on the dollar cost. So we would too, but we get IGT that makes that up. We actually get pretty close to cost here, if not more.
We did actually exceed the cost, yeah.
It's depending on how much IGT. you
Yeah,
get.
Whippley did a analysis of all of the critical access hospitals in the state that would have been eligible for under this. And what it found out was all of the district hospitals, the public ones, all made out better the way they are now because of the IGT.
Right.
And a lot of them didn't even give information because they didn't want to be part of it. I said, no, I was working with Catalina, I said our information right away because we wanted this building.
Yeah.
But anytime you take money from someone gets money, someone else is losing money.
Yeah.
So anyway, what we put out for in this bill is that, again, obviously right now, the way things stand, we're better off not joining in that group. But in the event that things change and all of a sudden now IGT dries up or something like that, where it doesn't impact us, we'd like the ability to opt in later on, if that makes sense for us to do.
Plan B, kind of worst case scenario.
Yeah,
It covers the managed Medi-Cal too, both.
yes.
Most of it's managed Medi-Cal.
Yeah, they've
Very much so.
eliminated state Medi-Cal. So, yeah, so that's kind of where those things are.
The one thing, Tim,
Yeah.
Ross probably could answer it better.
Yeah.
Where I read somewhere, here or somewhere, EMTs have to be on call during a break.
During break.
Yeah, I read somewhere about that.
Yeah, Prop 11 passed in 2018.
That's a good thing, isn't it?
Yeah, absolutely. You
Yeah.
want them on call, you want them to be available.
Yeah,
They're being paid.
yeah, right.
And if an emergency comes up,
Yeah, they
interrupt
have to
the break.
up.
Yeah.
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 Okay, but it did pass.
It did.
Okay, in 18? I'm
Yes.
just finding.
Yeah.
There are some good points and bad points to that, and now I'll share that with you later in a closed session. Because there'll be some discussion about that. But what else? We've got HR and marketing have moved. That went very smoothly. The staff was very, very pleased.
They're in the house.
They're in the house now.
Okay.
And so going really well. And then the other thing was we had Good Sam come up, Good Sam Hospital, their CEO, their CAO, and some other staff who are responsible for intake and those kinds of things. And they've gotten a number of grants, big grants, assigned to them for behavioral health projects and so forth at various levels. I mean, there's a number of things they're working on. One of the ones they're working on right now, which might be of great interest to us, would be a family practice residency program that they put in for federal funding that would require rural experience for the residents. And so what they want to do would be to partner with us to basically take those residents on, have a rotation through here, through our emergency department, through our clinic, through the acute unit, and so forth for their training, and so forth. And obviously, once you get access and exposure to them, then there's always opportunities to be able to potentially recruit them at the end of their programs and stuff like that. So that's one thing that they would like to partner with us on to do. So we're going to explore that. We had a number of things that we looked at with regards to, they've got a detox program that they've developed down there. And, one of the issues that a number of facilities are having, including ours, is we frequently did patients coming in that require a detox and so forth. They're detoxing on our inpatient unit, acute side, and so forth. And so those are patients that they can now accept directly down there and so forth and take that off our hands. Of course, if we have the capacity and so forth, obviously, we'll keep those. It's up to us to determine which ones we want to send. And then also we're looking at some outpatient services. And so just a lot of ideas that they put out there. They're going to summarize them for us and send it back to us so we can kind of start taking a look at what we might want to do.
I have a quick question.
Yeah.
You said that we could look at them and see which ones we want to send, but that's going to be due to the level of care,
Yes.
whether we can
What
do
it's about.
that or not. Okay, I just wanted to make
Yeah,
sure that,
that's the whole point.
use that wording.
Yes.
So one of the things they did talk about was they have extended facilities in Bakersfield that they put out there. So if somebody detoxes, they have a place to send them for 30 days
Right.
to stay clean and sober and dry and get them plugged
Get
into
the
various
therapy.
programs. And so I think that was her thought up here, is to maybe put something like that up here. We have so much recidivism with our detoxers that go home and they go right back to the same environment they left, and it doesn't stick. So that was
And then
promising.
they also had a second level.
And then
Provide
the
another
6 months second level that they do. So
Right.
she's got some pretty good ideas. She's grown Good Sam Hospital from a very minimally resourced facility to now she's in charge of 4 different facilities, and she's really growing that service down there. So,
Well, and I think they provide a lot of education.
yeah.
They do.
Staff
Not,
in that.
not to mention they have it in inpatient ICU,
Right.
and they don't have an ER. So they have beds available for patients who may go bad on our acute care and need a higher level of care.
Because now there's no EMTALA issues.
Right.
We can transfer from.
Somebody invited.
Higher
about
level of
that?
care.
Yeah.
No.
Anyway, so some great possibilities there. They were very excited, I think, by what they saw here. That was the one thing they wanted to get up here. We've been trying to arrange that for a while. And so Mark, I appreciate Mark gave them a tour of all the facilities, saw the clinic, they saw Electrolito's building and so forth. They went over and saw, I don't know where else you guys went, but
Yeah, they saw the mobile clinic. They were very happy to see that.
Yeah.
Kind of, I could see the wheels turning in her head. How she,
yeah, because they've set up some street.
Lisa
medicine-
showed us that.
some street medicine programs. They're out there treating the homeless out there using their mobile clinics instead of 2, I think, and so forth, that are primarily down in Bakersfield, but they're also getting out into a number of other rural communities.
Their mobile clinics are just smaller vans. They mentioned that. Like, how'd you get this big old thing?
So anyway,
Is that just mental health or do they do drug addiction too?
They do.
they do.
They do Suboxone and stuff? Okay.
Yes. Oh, they have a very active Suboxone program.
So exciting.
It's actually the other one. There's another one. Not Suboxone, it's different, but it's
The newer
does
one.
the same.
Yeah.
So anyway, so we're gonna kind of go after that and see what we can work out from there. Because there's no question that the community needs these services. So that's our. So that's my report.
Yeah, I'd like one more question.
Sure.
where are we at with anything going on with the VA? Is that,
Well, we were supposed to meet with the VA
Oh.
this morning.
Well,
it's on?
well, so Gary calls me yesterday, Carrie's dad, and,
He called me too, just so you know.
yeah, 'cause
He didn't call me.
That's called him too. That's right.
he calls you all the time, like, this time around. She-
Ross, did you get a call? Me either.
They tried to call you at exchange. So, no, they were supposed to come to the VFW breakfast today, and I was gonna invite Tim, I couldn't make, but Tim had to go surgery
Surgical clearance.
clearance today, so Mark was gonna go. And then Gary said, well, the VA is not coming, but then when I went to Exchange Club today, I guess somebody from the VA did show up, so they were here. But he relayed to Gary that they are still very anxious to partner with the hospital and like to get that going as soon as they can.
And
Did we
Gary,
invite them? to
Gary
the
gave
Getty
me,
feed?
Gary gave me the two
Nothing worse.
contacts that I should be looking out.
Correct.
And they have changed department heads since we started this
Wow.
process a couple of times.
Several
Yeah.
times. Yeah.
That's government.
And that's one of the things that has slowed this whole thing down, because just when you feel like you're finally making some progress, they change the people out. Now you start from scratch again.
They're on to us.
But they were very impressed with the mobile clinic. They did do it.
That's-
So I think the last
They
time
did,
they
they
were
were
here.
Yeah, I think we had looked at that like when they first came.
Right.
So, yeah, good.
Everybody's licking their chops with your mobile clinic, Greg.
Should we address this differently? Rather than wait for them to propose a contract to us, maybe we put a contract together and say, here, sign this.
Yeah, the issue for us is gonna be defining the service. Is that there's
Let's
so
define a
many
forum.
options there.
Define what's gonna be most advantageous to us and pitch it.
Well, like I said, I think this is what they were gonna do. They were gonna go back and they were gonna put together a listing of all the things they had. We got a bunch of brochures.
I know, but they haven't done it yet.
Well, this just happened this week.
Oh, okay, all right.
They were here Monday. So, the idea there is we're gonna put the whole list together. And then what we'd like to do is, because Lisa wasn't able to join us at that meeting, and so we're gonna sit down and talk to her, find out what she believes some of the needs are. Mark has talked to, Clinica, to see they've got,
Alana,
to see.
are you,
what,
which one are you talking about, VA, or are you talking about the other?
The other.
You're talking about
Minty.
VA.
I was talking about VA.
Oh, I thought you meant for the behavioral.
No, the behavioral thing you described sounds wonderful.
Yeah.
But the VA, this has been lingering for a couple years at least.
Right.
I'm just wondering, can we move this forward by saying, here's our contract, sign it?
Yeah, we're,
VA's bigger than that.
I know, but maybe,
But I like
To move.
the idea.
the idea, yeah,
take
we
the
should take.
Yes, you do.
maybe it'll prompt them to move.
Okay, yeah.
You'll at least get an answer, yes or no, one or the
Yeah.
other. So, yeah, I think Greg and I need to sit down, obviously, and talk about capacity issues, and so forth.
The one thing we have to our advantage, we're a little bit unique. We're distance in the other hospital.
Right.
They pay for the patient to drive
Yes,
69 cents a mile.
Right.
They gotta go to down south. It's $150 a month,
Wilshire Boulevard,
even going to,
yeah, right,
it's $40-50. So,
which should be attractive.
yeah, but other places, it's not like we're isolated.
And maybe next time they come up, we can take them through the new administration, because they came when it was nothing.
Right.
You know, we hadn't done anything, and
Right.
they can see the big
The change.
changes that have gone on there and stuff too, so.
So anyway, we'll start putting some.
Could I just mention in the
Yeah.
administration?
Yeah.
We're about 75% capacity in parking right now. I know we talked about it,
We did.
but it's gonna be a problem. If we put a conference room there, there's no parking.
Again, yeah, well, we've talked about that. We actually had, Mark and I were chatting with Candace about it, because Candace who owns the restaurant, her parents own the lot between us and so forth, because Mark had asked me, says, hey, you ever thought about paving that lot out there? Oh, it's just expensive. I said, there might be an opportunity for us to come back and say, hey, we'll pave it if you let us use it for parking. They're not using it for anything right now. I mean, she's got some people that are parking in the dirt during lunchtime and stuff like that. So That's one option. The other thing we want to go back and take a look at is the lot on the other side that you brought up before. I gotta go back and see what the book value is on that or the,
The one across the street, almost the same size, sold for $16,000 about 3 years.
really.
And so, but she wanted 55,000 about 15 years ago.
Yeah. So she
Didn't
did that.
sell.
Right.
She might be thinking down.
Yeah.
Might
We're
be
gonna
up.
reach out, we're gonna see if we can reach out to them and, because they're down in LA or
Yeah,
someplace.
we could need, Bob's not here, but we could have a septic problem with all the activity we're getting. I know it hasn't had that type of activity. But
Yeah, that was all scoped out and stuff like that. We had somebody come out and run the
yeah,
cameras through there and stuff like
but it
that.
can become a problem, and that
Yeah.
would be an ideal thing to have.
Sure. Yep, absolutely.
Well, thank you, Tim, for your report.
You're welcome.
Pretty informative, lots of stuff.
Yeah.
So, Gary, you're up.
Hello.
Hello.
This one.
I
No, they
did.
did that earlier.
Oh, yeah, we do job description, quality.
Is Dina on there? Yes, yes.
Oh, yep.
Tina, do you want to explain the job description, what you're looking for there?
Sure, okay. I have to talk to you about it more, but, yeah.
Yeah.
I'm just looking to, more needs to be expanded into the hospital, interaction with staff, interaction with departments, and with the amount of data that I'm having to, manage right now just for promoting interoperability, and all the government regulatory stuff, I just don't have time to be out there, doing both. And so I just needed some help so that I can develop some programs within the hospital on patient safety, on quality improvement, where we're posting our stats, we're interacting with the staff to promote all of these different programs that we can do. So that's just where I needed some extra support to get those
Yeah.
types of things done.
And the issue there, like I said, is there, every year they're adding more and more requirements on Dina and the hospital for new things they want to look at, how they want this to be presented to them. That has created some technical difficulties at times as to how we're going to get it. They want everything electronically submitted. And sometimes ours is not available that
Can
way.
I make a motion that we accept her request? I
Absolutely.
mean, it's
She needed
it's
that.
wonderful.
Well, this is,
We need it.
this was one of our strategic initiatives, was to continue to improve quality and so forth. And I think this is a great step in that.
I know we still have discussion, but I wanted to put it on.
Yeah, I appreciate that.
Dina, is this a full-time employee?
If possible, yes. But I believe we already still had 0.25 in the budget from all the previous years. I think when we used to have a care coordinator or something in that position. So I believe we only had to add 0.75 if I'm, you can correct me if I'm wrong.
Half it empty, you can, sure.
I'll make the second on Jean's motion, but I have a question too. This essentially, I agree, it's absolutely needed. We need to move forward with this. I support the motion, but there's a cost to it. Through all the regulations, basically, we have to pay more for our administration as a result of those regulations and these improvements. What is it? What's the bottom line? What is it going to cost us annually?
35,000 maybe, the half an empty extra is probably about somewhere in that range.
Yeah. The benefits could
Okay.
far outweigh that.
Well,
That's true.
yeah.
It ends up in a
They're
five-star.
getting penalized for not doing some of this stuff, so that exactly.
Sure.
Reimbursement as soon as would be based on quality
Right.
indicators.
And if we
too,
look
so
at
it's gonna be
5-star,
Okay.
Yeah.
All right.
then the 5-star, we get better money.
Yeah.
Plus more patients.
It's the
You
right
attract patients too, the more higher quality you have, more
Right,
patients you
right.
attract.
So, I mean, so there's big benefits to it.
I have a question. Dina, where's this person going to sit?
Well, right now, in the office I'm in Dr. Leho's old building, there's room for 2 of us, so it just depends on where we're going in the future.
You're over there.
Yeah.
I don't know why I didn't know that.
She could almost be over there in the old building, right?
I thought she was like,
The halls are echoing where she is now.
You've got lots of room.
Not for long.
okay, that's all I'm just kind of curious. Are you over there by yourself?
Well, Lisa and the QIP program are over here, but in this side of the building, I'm by myself, yes.
Nice.
That's where transportation is too, but they're always out of there.
The very front, yeah. There's
Good,
not-
good person. So,
All right. So, is there any other discussion you guys want to have on this?
It's needed.
Everybody in favor?
Aye.
Perfect. That was everyone. No nays? No nay. Stupid. All right. There you go, Dina.
Thank you.
You're very welcome.
You won't be disappointed. In a year's time, you'll see a huge difference.
All
Dina, I don't know that we've ever been disappointed in you. So, thank you.
Thank you.
I come back to
Point
work.
and click. Is that a military thing?
Point
sounds
click
that way.
care.
No, it's this.
You can push the volume up button, believe it or not.
No, that was the oxygen off.
He doesn't know it, but I'm sitting on his,
Would you like me to start?
So, yeah, could you do that?
Yeah.
Get
If
me
he's
out of
closing
trouble.
his eyes, he's going to sleep. But there's a
Okay.
reason for that.
So maybe 2, 3, 4 months ago, I came to the board and I got a CER approved for training for the Point Click Care project. At the time, I had an estimated cost for what that training was going to be. I estimated it to be $5,000. I was wrong on the bad side of it. So we finally got a quote on September 4th for what training will be, and the cost is $12,000.
A lot of things have gone up anyway.
What? Yeah, in 3 months, huh?
We don't have much of a choice, do we?
Well, in honesty, all honesty, you do. You could say, no, we're not going to have on-site training. And we could elect to do the training, which is provided virtually through Point Click Care. That training has already begun. And Ben can attest to this. That training is poor. If you're being,
Like I
if
said,
you're
we
being
don't-
nice.
Like I said, we don't have a
it's
choice.
extremely poor.
Right, exactly.
But you do have a choice,
Correct.
but I don't think you should do the other one at all.
How's it? Ask Sherry.
Sherry?
Well, I've sat through a training and there were words I cannot use.
We tried it at Castle.
So it wasn't beneficial.
It did,
No.
we ended up having to go
The
bring somebody else. to
training-
bench.
Yeah.
And it just delayed things, so it did.
Right,
Okay.
so we're trying to get ahead of this. The plan would be for them to come out the week prior to go live and then the week of go live so that they could help us do some of the busy work beforehand. They'll go home for the
That
weekend,
should cover
come back,
costs.
and then we should, and then they'll be back.
Can I make a motion that we accept this?
There is an error on here though, too. If your math is solid, 20% of that is not $240, so it will be $2,400.
That's what I was thinking.
Oh, add another zero.
Just one more.
Is this,
Which side of
this
the
firm, they're good at Point Click Care?
I've never used them, but this is who Point Click Care recommends we use. They have that's why all this stuff is in here to tell you about who they are.
Are you asking about the EHR or the trainers?
These people who's,
The trainer, Rick,
yeah, I just,
they seem fine.
well,
I've never experienced.
You're
it
not
before.
selling it, buddy.
But
let me,
I don't have any other options. This is who
let me
they,
put it this way.
yeah.
If Point Click Care developed the training program that's really poor and they're recommending these people, should we listen to them?
That's a great observation, but these are the people who are licensed with Point Click Care to train
Okay.
the product. So
All right.
I can't just go find somebody else.
Okay.
I mean, I could try, but I'd probably fail.
Yeah. Well, I'll
So
second
that's the
the
plan.
motion.
Okay. Clinica, at the Department of Human Services, there was always a turnover on here too with Carrie going on it, but always a change in either new computers or new programs. And I've done both of, online training or in-house. And in-house, they'll train, usually they train you how they're supposed to train you, and then they'll go, and these are the shortcuts. These are, it's like, do you have to put, print, or can you do Control P? So there's just, they teach you the little tricks that make it easier for you too. So, yeah, in person would be always.
Yeah, and it's our
We did that, when we
preference.
put in CPSI originally.
Yeah.
They came on site, I think, for 2 weeks or something like that, and it makes a difference because they're sitting side by
They were
side.
here for days and nights. They were here.
Yeah. Our only issue there was we wish had we known earlier, we would have contracted for more time. But it was so much more effective than to try and
Yeah.
do this off a screen or something like that, so.
And I am trying to get Point Click Care to pay for this because what they were supposed to do was mirror our cost for AHT. That was the arrangement that the two companies had. And I said, if you guys can't supply adequate training, which you are not, and they admitted that they heard that a lot, then you should cover the cost of this training too. So evidently that's been escalated to their leadership
Good,
team.
good.
I can't make it.
Maybe they'll give us a
We'll see what
discount
happens, yeah.
equivalent to this.
Yeah.
Yeah,
Yeah.
good. Good, thank you.
Thanks, guys. We got a vote.
Yes, we do. Those in favor?
Aye.
Any nays? Okay.
Cool.
Harry, you can only come twice next year.
These?
No, for income, for any money.
You better watch yourself. You're gonna be used.
All right.
Also haven't got into Kern Nelson. We have a
Um,
running thing going with their CIO down there just because he would come and there were millions of dollars every time he walked in. It's like, it's just peanuts down there.
Yeah.
Technically, this will fall under Sniff's budget though. I'm spending other departments' money.
All right, you're good.
Found the
That's good,
loophole.
Harry.
Yeah.
Yeah. We're going to, director's comments on items not appearing on the agenda. Ross, would you like to go first?
Sure. So I saw in the newspaper yesterday, there's 5 acres available for free in Bodfish. This is a big vacant lot. Lake Isabella Boulevard and the old Canyon Road. Yeah, right across from the post, that big 5 acres for a public agency or a nonprofit agency to use for a public purpose for free.
Is that the one by?
Wow.
All we have to do is step up and say we want it.
We'll put the parking area up there.
You got transportation.
I wanted to bring this to your attention. I think it's we probably need to move fairly quickly. So I didn't know if the board was interested in maybe
It's
having,
reasonable. Is it reasonable?
it's very level, yeah.
So the kind of money that Minty was talking about could build a building on that
Yeah.
property.
So it'd be another presence in the community. It's not anywhere close to our facility here. I don't know how we might use it. But if it's available for us to,
We can use it for PR. Debbie can take it. Put pickleball courts in.
there you go. There you go.
Oh, for exercise,
Indoor pickle.
exercise.
Those big steel
You're right.
courts you can put up real cheap.
And then you could put do some landscaping on it and put one of those fitness routine things like we have up in
Yeah.
Kern.
That would be good
Riverside
PR
Park.
for
Oh,
us
that would be
Yeah.
good.
With no cost.
Yeah.
Makes
So-
sense.
I know that we can't take action because it's not on the agenda, but are y'all comfortable referring this to Tim to pursue and
Yeah,
find out
yes.
more information about it?
Yeah, you shoot me that, whatever you saw.
Yeah, it's in the newspaper.
Okay, great.
It's not electronic.
Great.
It's an ad in the newspaper.
Call him this afternoon.
So I thought, but it'd be worth having discussion anyway.
Now, Bodfish is still in California.
Yeah, as far as I know, hasn't seceded yet. I've got a couple other things, Catherine.
Okay.
One, I wanted to let our PR folks know, Carrie and Debbie, and all the folks that work to make us look better to the community. Or not make us look better. We look great, but you're telling
Just
the
let people
story.
know.
We should polish it up.
Hey, the billboard looks great. I think it was really good that we were able to capture that and Nettie, whoever did the design on the billboard, I think it looks terrific. And the employee newsletter that came out this last week or so. Wow. Really good, really good. So just wanted to, this is near and dear to my heart and I just appreciate the work you guys are doing.
Appreciate that,
Thank
Ross.
you. There's the organization that your mother is involved with, Bridge, something Bridge,
Bridge connection.
Bridge Connection, is that what it's called? They're opening a facility on Lake Isabella Boulevard where the ambulance used to be, where Century 21 used to be, that building.
John Lapham's doing construction out front. Is that what's going on?
Yeah. They're going to be having a presence there as soon as the building's done. I think their target is October 1st, so very soon. And I didn't know if that was maybe an opportunity for us to use our mobile clinic for street medicine initiative. I don't know how often. I know that, you know, our providers have full plates.
Yeah.
But I think it's something that we need to be working towards. Because
Atlanta does,
revenue in it for us.
Atlanta does street medicine out of the Sierra.
Yeah.
Okay.
Does do street medicine out of there. She goes to the homeless population and helps out. But I agree that that's not a bad idea.
You know, there's a significant homeless population in that vicinity of that building. And it may be a really good way to help the community out in maybe improving their lives. And I'd kind of like to see us move forward with something like that if we can get the extra provider time to actually make it happen.
Well, this is one of the things that we did talk to.
Yeah, we talked to Minty about this.
So,
Okay.
good thing.
So we don't know the locations or anything. I asked her how she sets up her in-home treatment things, and they buy old houses and they restore them, and then they just put a MA or a CNA or an LVN in there and manages the house
Oh,
for
interesting.
3, 4, 5 people that are, you know, and
It's paid by the current health
it's
system.
paid for by the current health systems. And it's a good program.
Hotels around.
Yeah, we do a bunch of.
I was thinking about what's available around here, and there's a few places around here. A lot of times neighborhoods don't want those
Sure.
types of
Yeah.
element around, but
Right.
we're talking about a pretty benign area up in Bodfish that would be not in a neighborhood.
There's 5 acres up there for,
That's not a bad
Not a bad
idea.
idea.
That's what I was alluding to, yeah.
I was thinking the boulevard near that bridge facility because it's going to be a magnet and there's already a significant homeless population there.
Yes, there is.
Can't we just plug into that building a couple times a month
Might be an option. So
with our mobile clinic?
Sure, I could have a conversation with them if you want.
And Greg would have to have.
With positive results.
Anyway, I'd throw it out there just because I think we probably ought to be looking at this
You
moving.
probably should do it sooner than later.
yeah,
Yeah.
I'm gonna take a look at it this afternoon. If I could make a call this afternoon, just let them know our interest. Just to get our name on the.
Yeah.
Paper there.
Okay. Thank you. That's all, Catherine.
All right,
That's
thanks.
great.
Lots of information. Thank you. John?
Just a couple quick.
Wrong John. You know what?
John is the surf.
Good response. That's awesome. He was ready to go.
You want to go? No. Just a couple of things. And there's been a lot of concerns with the volume increases at the pharmacy. And I don't know, maybe that might be an idea for the property in Bodfish to do a satellite pharmacy down the road. Anyway, I ran into a gentleman that I know in town, and he had Rite Aid, and subsequently got frustrated with Rite Aid and then moved his scripts or his pharmaceuticals over here, and was worried about the volume and, you know, delays or whatever. And he said despite them being busy, he got it like immediately.
Oh, they're great.
So
That's good.
he was very impressed with, even though they're inundated, how quickly that they were able to get the prescription filled.
Yeah,
Also trying to focus on output. And get-
yeah, and you know what, that's,
Don't upset any of the new people coming.
that's a good thing, because you know, in doctor's offices and stuff, they tell you it's gonna be like 72 hours before they, will, you know, get it, at least even to the pharmacy.
Right.
So
He,
if,
he got a text, I guess, really
Yeah.
quickly that it was ready to go.
perfect, that's,
Great.
that's good.
And the second thing I wanted to mention, I just found out in the last year that Joanne Jones had passed away. She was a longtime employee and been on the board here for about 8 years.
I didn't know that.
Yeah.
Is that surgery?
Yeah.
Um, anyway, that's 4 former board members that died in the last year. And I just, I like to just mention that because of their service on this board as an elected official. And when people kind of go through the cracks like that and you find out, oh, they passed away, like Barbara Cassis. I had no idea that she had passed away months until Heidi had told me about it.
There's something we could maybe do, put a plaque out in, the lobby or wherever, just recognizing past board members.
Well, and they used to have stuff like that before, I thought.
It was,
They had the tree of life.
foundation or
Yeah,
the
that's what-
distillery. The tree, was it foundation or was it?
Foundation.
Okay.
I think when Fred Dodds passed away, they dedicated one hall to him.
Yes, there was one on the wall there
Yeah.
Kay Simpkins has a plaque as well.
by where the classroom was, right?
Can I ask you a question?
Yes.
Why did Ross look at me when he said past board member? I'm not that old.
I didn't do that.
Anything else, John?
Step on.
That's all I
Jean, do you have anything you'd like to?
The Kissick building. Whenever he developed this whole area,
Yeah.
I think everybody knows that. He elected to do the alley himself. He put the pavement in. I found out that we've got a friend that asked the guy in charge to pave ours. That's how it got paved. Oh, and so that was very cool.
Yeah.
But
I wish they'd have done Candace's, right by the.
Yeah,
wall.
right, yeah.
All right.
Fill that in.
That's All right, cool.
he
That's
might have
good.
done it if we would have asked.
Yeah.
But
Yeah, as long as they were here.
You still
They're
have
not done yet.
up the street, McRae.
yeah, that's a good idea.
Yeah.
They did most of it. Others, April.
Well, down on her lots down there, she had them bring it right up onto the, in the.
There were some really bad ruts right in front of.
Yeah, there were. And they took care of all that stuff.
Well, and on the side where it says directs you to cocktails, that road, yeah.
That one.
Anything else, Jean?
No, I know. Thank you. Thank everybody for their patience. I shouldn't say that in the hospital because
We thank the community.
Right.
for
confused
their
with
patience.
patients.
We know what you mean,
NTS.
Thank you.
Other than the newsletter looked great. Thank you for that. It's amazing. But no, I have no problems. Thank you.
I usually have a lot, surprise, but, I haven't heard any, concerns in the public. And I would assume, like with other board members, if I'm not hearing anything, that's probably good. It's when someone has concerns or complaints or something going on, then they find you. They know like what time I'm at the grocery store or something, I don't know, but, it's, so I'm just calling and picking my groceries up out front. Maybe that's why I haven't heard, but things seem to be going well in the community with, maybe it's because it's an election year and they got other things to worry about. I would like to think though that we're doing a good job and we're meeting the needs of the community. And I think, with the pharmacy, I'm sure they're doing a ton of work, because taking on however more new medications they are, or even members. I mean, each person probably has more than 2,
They were paying for 6,000.
They did, in August, they did 5,200 up to 3,500, so about a
Wow.
50% increase, and we're trending this month, 55 or so.
That's nice.
So it's continuing to grow. Now we just need to keep.
We just need to keep them, and that's gonna be the
And with,
key.
with performance like you're explaining.
That's what.
Trust me.
Ludo will keep them.
Yeah, that's
He
good.
does amazing.
That's good. So, that's all the comments I have.
If I may, just to expand on what you just said. It's not just everybody that's room and everybody within this facility. We have 5 board members here that take this really seriously. And we allow it to show probably a little bit more than we should at times. That's the 5 of us putting the pressure onto all of you to make sure we do it right. That's just something that's key, and I think it's something that needs to remain.
Yeah.
We put some of that pressure on ourselves too, because,
Yeah.
you know, it's what we do. It's our job. So
Problem is, it's more than a job.
it is. It's absolutely correct.
It is. It is. So, well, thank you, Fred. We're going to move into closed session.
Before I do,
Oh.
one more comment.
One more.
And we had just an issue that came up today. About 2-3 days ago, was sprung a leak in the refrigeration unit in our walk-in refrigerator. And so forth. And Bob was able to go in and put some more coolant in that thing, and it lasted us about 3 days. That went out this morning. And so forth.
It has all your Crab Fest food.
All the
Well,
crap.
And about, after the board meeting, we received a call from the public about one of your employees. I
I muted him.
Excuse me?
He was talking something
Oh,
on a different line.
oh, he's talking about someone to call him about after, but so. Anyway, we went ahead and secured a refrigerator truck that's gonna be here later.
Oh,
today.
good. Oh,
And
good.
we're gonna move all that food in there because we lost it the last time. It went up to like 57 degrees in there. And so forth, we were able to get that fixed. So, and then the gentleman who's refilling that for us is the one that's gonna be actually, this gives us, it's a monthly rental, it's $2,000. I said, listen, I can't afford to lose more. We paid more money for food.
$10,000 of food, yeah.
Exactly. So, but that gave it to us for 1 month. So, that's going to be delivered here shortly. And so we're going to literally move it all in there. And that they can clear that room out and then get that thing up and running. It's a permanent thing. So just wanted to share that with you. Because there was discussions earlier today about canceling the Grab Fest. So, that was how concerned they were about it. So.
And there's a guy that does nothing but commercial refrigeration and restaurant equipment or cooking equipment.
Yeah.
Commercials, right here in the Valley. He's very reasonable.
What's his name?
What's his name?
I
We got a guy
I
from up here to
I
do it.
insured him and I
We
can't,
got a guy up here that's gonna do that for us, and it might be him, I don't know.
Could be, yeah.
then Bob probably would know him because he lives in the same general area.
Okay, good. So
But I'll check with
we
him.
jumped on that right away. So that's being addressed.
Okay.
Kudos to Christine for finding us a truck. The issue that was so difficult was because guess what's going on this weekend?
Yeah.
County fair. So all these refrigerated trucks are all being rented by the county.
We're at the fairgrounds right now.
Yep.
holding on to that.
So lucky to go.
All right. Thank you.
You're welcome.
Anything else? No. Okay, we're going to move into closed session. And it is 3:18. Well, we're pretty chatty today.
All right. For it to turn red. There we go. Okay.
It is 4:00 PM and we are coming back into session from the closed session. Scott, if you would give the closed session report, please.
Sure. The Benson and Volkova matters were not discussed. There was no update this meeting for those. Council and the CEO updated the board on the Rostad matter. No action was taken and no other items were discussed.
Thank you, Scott. And it is still 4:00 and we're going to adjourn the board of directors meeting.
Wait 2 hours.
Thank you all.
Have a good day.
Thank you.
Thanks,
Thanks,
Scott.
Scott. Thanks, Scott.
Bye.